Welcome everybody to our third seminar from the series called Effects of the COVID-19 Pandemic in Latin America and Europe. My name is Iga Musiałkowska. I'm head of a Department of European Studies from the Poznań University of Economics and Business. And we are organizing jointly this seminar series together with the Embassy of Poland in Mexico. And I would like to warmly welcome the representatives of the embassy who are with us today, and also with the Institute of Economic Research of the National Autonomous University of Mexico. And what I'd like to stress that these seminars are held under the auspices of His Excellency Ambassador of the Republic of Poland in Mexico, Maciej Ziętara, and His Magnificence Rector of the Poznań University of Economics and Business, Professor Maciej Żukowski. And I would like also to underline that organization of these events wouldn't be possible without the help of many people who are in here. And I would like to mention Professor Armando Sanchez Vargas and Dr. Isalia Nava from the UNAM, and also Dr. Michał Faryś from the Embassy of Poland. So thank you for co-organizing these events. And now I'd like to switch to today's seminar, which is entitled Social and Economic Implications of the Pandemic for Sectors and Regions. And it would have the same format as the previous seminars. And today's seminar will be moderated by Professor Alicia Girón from the National Autonomous University of Mexico. And it's my turn to present you, and then I will give a floor to you to continue with presentations of our speakers and then leading the question and answer session. So Professor Alicia Girón is a coordinator of the University Program of Asian and African Studies since May 2017, and also coordinator of the Asian Studies Seminar. She's also a researcher of the Economic Research Institute of the UNAM, and she obtained her bachelor degree in economics from the Faculty of Economics, and master and PhD in Latin American Studies from the Faculty of Political and Social Sciences. She also is a tutor of the postgraduate program in economics, Latin American and administrative sciences at UNAM. Her main research topics are financial economics, particularly related to economic cycles, financial crisis, sovereign debt, and a financial system. She has researched also aspects related to gender economics and its relationship with financial circuits at macro and microeconomic levels. So, Professor Alicia Girón, now the floor is yours. Thank you.
Thank you very much. Welcome. Good morning, Mexico. Good afternoon, Poland. And it is an honor to be here to moderate this great event, talking about social and economic implications of the pandemic. As we know, all the countries in the world have been affected by this virus, and our lives have changed a lot. So I'm not going to repeat the names of the people that are with us, but I am going to introduce you first to Professor Łukasz Puślecki, and later on to Professor Carlos Bustamante. So I'm going to read just a very brief CVU of Łukasz Puślecki. Professor Dr. Łukasz Puślecki is the chair and co-founder of the Academy of International Business, Central and Eastern Europe chapter. He is principal investigator in a national science center funded project entitled Analysis of Open Innovation, Alliances and Strategic Partnerships in the Biopharmaceutical Industry in Poland and CEE countries. He is researcher and lecturer of the Department of International Management, Institute of International Business and Economics at Poznań University of Economics and Business. And he also is his research focus on research and development cooperation and partnerships, innovation cooperation, Research and Development Alliance, a Strategic Alliance, a Strategic Technology Alliance, Open Innovation Alliance, mainly in the biopharmaceutical industry, international trade and services, as well as own innovation, technological competitiveness, and knowledge-based economies. Professor Łukasz, here is a very interesting talk that you were giving, but especially as I see your specialization is in pharmaceutical industry. And right now, there are only 3 big pharmaceuticals that are that have been and are distributing the vaccines around the world: Moderna, AstraZeneca, and Pfizer. And behind there are the ones at Sputnik from Russia and Sinovac from China. So, dear colleagues, we are going to have a wonderful talk today. And Professor Łukasz, I give the microphone. Thank you very much to be here with us.
Thank you very much. Thank you very much, Professor Alicia Girón. Thank you very much, ladies and gentlemen, dear professors, dear organizers. It's a great pleasure for me to be today with you. Good morning, Mexico. Good evening, Poland, as we have the meeting into different time zones. Today I would like to share with you a very interesting topic about boosting innovation cooperation in Europe for the COVID-19 pandemic defeating. So with the question in the title, can we open up to improve the patient care? So now I would like to share my screen with you. I will see if you will see if it's possible. One moment. Okay, can you see the presentation?
Yes.
Yes.
Okay, so just one moment. Okay, so as you can see, it's our online seminar. So today we'll try to discuss the effects of the COVID-19 pandemic in Latin America and in Europe, with the perspective of social and economic implications of the pandemics for sectors and regions. Starting with agenda, just to say a few words about what we will have today. I will start with a short introduction. So why I've decided to present this topic. Then I will try to share with you some information about boosting innovation cooperation in biopharmaceutical R&D innovation ecosystem. Then a very nice part regarding COVID-19 vaccine projects. Professor Alicia Girón already mentioned a few of the existing vaccines, but there are also some still waiting in line. So I will also try to share with you and make a short overview of these vaccine projects. Then I will try to present you some selected research projects from the European Union, mainly from Emmy and Horizon 2020 projects, then promising first results of Horizon 2000 projects. And after that, I would like to share with you also information about the role of open innovation in COVID-19 pandemic, with the question, can we open up to improve the patient care? And at the end, I do hope we'll have some conclusions and maybe we can wrap up some discussion afterwards. So can you hear me quite well? Everything is okay? Can you hear me? Okay. So starting with introduction, as I told you, why I decided to present this topic. One thing is, of course, my research grant. So I'm a principal investigator and in a team with Piotr Rączyński and Michał Staszków. For few years, we are contributing we are conducting a research grant titled Analysis of Open Innovation Alliances and Strategic Partnerships in the Biopharmaceutical Industry in Poland and CE countries. The problem is that our research, what we've conducted in this grant, just finished before pandemic started. So we have some results before pandemic, but we are also now in time try to develop it and also try to gather some information from companies during this pandemic as well. Another reason was were the panels at several conferences. I had an opportunity to chair and to participate in several panels at IBA conference, AIB, AIBC, Central Eastern Europe chapters, devoted to different topics, starting with innovation cooperation, then research cooperation, business academia cooperation. So we have a very lot of interesting discussions, and also some very nice research topics for our future publications. And the last reason is, of course, the pandemic of COVID-19 and the crucial role of innovation cooperation in pandemic defeating, especially from the perspective of improvement of patient care. So here, I will mainly try to focus on new vaccines, diagnostic treatments, digital healthcare, telemedicine, personalized medicine. So all the important issues that support different patients with different stage of illness and will help us to COVID-19 pandemic soon. When we think about biopharmaceutical R&D innovation ecosystem, as you can see in the center, in the hub, we have patients as a hub of the ecosystem, and they are also the key participants in driving patient-centered innovation, but also they receive a lot of value from the innovation cooperation from all the partners, different stakeholders involved. As you can see, we have a lot of variety of stakeholders, starting with biopharma companies, healthcare providers, investors, federal research, academia, regulators, health plans. So a lot of different entities working together to develop new solutions. And of course, this kind of biopharma R&D innovation ecosystem were also developed before pandemic, but now during the COVID-19 pandemic, this kind of ecosystems are even more important in the development of new breakthrough therapies, yeah, and also in development also for new vaccines. So when we think about vaccines projects, as already mentioned by Professor Alicia Girón, we have now in Europe 3 available accepted by European Medical Agency, so Pfizer, Moderna, and AstraZeneca. But as you can see, nowadays, currently, we have more or less 50 candidates for vaccines in clinical trials in people, and more than 150 candidates are in a preclinical development, including animal and laboratory testing. So now I would like to present you some kind of short information about overview of selected COVID-19 vaccine projects with some recent results. So, of course, the one available on the European market, we have Moderna. As you know, it was approved on 6th of January 2021. And the very positive result is mRNA vaccine with 94% in initial phase during trial results. So a lot of different patients could be really happy when they receive this kind of vaccine, because they have quite high level of effectiveness. The second one is Pfizer-BioNTech, and this also is the second of mRNA vaccine. It was accepted by the European Medicines Agency in December, on the 21st December, and of course now everyone tried to verify the role of these vaccines in so-called new version, new variant of vaccine, so South Africa variant. And as you can see, in late January 2021, company officials said a study indicated their vaccine is only slightly less effective against the COVID-19 variant from South Africa. What's more, we just received information a few days ago that this kind of vaccine, so the Pfizer, BioNTech, and Fosun Pharma, they have like a 90% prevention before the transmission of virus to different people. So this is also another important thing for us as patients. Then AstraZeneca, the last one, which is now available on the European market, accepted on the end of January, on 29th of January 2021, with 82% effective after 12 weeks. and 76% efficiency in preventing disease transmission. Of course, the problem is that we do not have a very positive information regarding the variant from South Africa, so the mutation of this virus, because this vaccine is not effective. It wasn't effective in preventing mild to moderate illness with this kind of variant. The next one, we have Johnson & Johnson. So we are waiting for this vaccine. Probably it will be accepted by EMA soon in mid of March. As you can see, it's the product from daughter company from Janssen Pharmaceutica, but they have also quite very positive results, 66% effective overall and more than 50% against the new variants. And we will see if it will be offered as one dose vaccine, because this is quite specific comparing to AstraZeneca, Pfizer and Moderna, where we have 2 doses. Johnson & Johnson vaccine is only 1 dose vaccine, but we do not know exactly what would be the situation from the perspective of the company. Maybe the company will be also willing to offer 2 doses. Yeah, we'll see what will be the situation later. Then we have some other vaccines, of course, Sputnik, so from Galaya Research Institute, which is already in application in Russia, Belarus, in United Arab Emirates, and in India. We have also Novavax. Novavax is another example of vaccine with a very good and positive results from clinical trials, with a 90% effective overall and 60% effective against the South African variant. So we are also waiting for this vaccine to arrive soon on the market. Then we have Inovio, so another example from a company doing vaccine on the basis of recent vaccines and former vaccines for MERS. However, here we still wait for the decision of FDA and also for Emmy. And then we have also Chinese vaccine, CanSino Biologics, with approval for the Chinese military and also applied in Pakistan, Saudi Arabia, and Russia. And 2 vaccines from Wuhan Institute, so Sinopharm, which is well applied in China, but also in United Arab Emirates, in Peru and Morocco. And of course, another option to verify different solutions. So Beijing Institute of Biological Products also working with Sinopharm to verify different second inactivated virus vaccine developed in China. Then we have Sinovac Biotech, also from China, and Indian, still waiting for the results from the 3rd phase of a clinical trial. So as you can see, of course, there's also some inline CureVac, GlaxoSmithKline, and Sanofi. So probably in this year, in 2021, there are like 8 agreements with the European Union. So we should have 8 vaccines available on the market. But what are the main problems with the vaccines? Yeah, so finding a vaccine and having the vaccine is not enough. As you can see, one of the biggest challenge for 2021 and for the not only maybe 2021 but also for 2022 will be a mass vaccination. So the problem, of course, is with the transfer, is with the transportation, with the delivery. And especially when we think about mRNA vaccines, they need to have a special temperature. So they need to use a so-called dry ice to transfer. And we had this kind of transfer already on the European market using the air transportation. So KLML and Air France, they offer this kind of service. But if we want to develop and offer these vaccines to different markets, we should also use this kind of experience and use this knowledge for different other markets. The problem nowadays is that more or less in 100 countries around the world, no one has yet been vaccinated. So this is a huge problem. And what we need when we think about vaccine projects from the perspective of innovation cooperation, we should ensure so-called universal access to COVID-19 vaccines. So for global challenges, there should be global solutions. And because if we do not do it, it will be not possible for us to protect us from new outbreaks of infection in less developed countries. And as you can see on this nice map, 85 poor countries will not have widespread access to coronavirus vaccines before 2023. So this is a huge problem when we think about new normal, coming back to new normal. As you can see, rich countries will get access to coronavirus vaccines earlier than others, and especially the countries in Africa, they will have an access in 2023. And here is also the role of European Union, World Health Organization, and different public-private partnerships, Javi Alliance from Bill and Melinda Gates Foundation, to take care about also these poor countries to develop and to give the opportunity to offer the vaccine as well there. From the perspective of research projects in the European Union, so here I would like to share with you some results and initial results of Emmy and Horizon 2020 projects. As you can see, these projects they've attracted more than 700 partners in EU-funded projects from member states and beyond. So we have a lot of different countries involved and representatives in the cooperation. We have also some partners outside European Union, so Albania, Bosnia and Herzegovina, Israel, Norway, Serbia, Switzerland, and Turkey. And what's quite interesting, we have also a very nice portfolio of different partners involved in the cooperation, starting with, of course, research institutions, organizations, then with the private entities, and 75% of which were SMEs, small and medium enterprises. And now I would like to show you some examples of this project. But before we do it, one moment, I have something on my screen. Okay, sorry. Okay, I will be done. Okay. So, so one thing is, of course, that we have an opportunity to also to see what kind of COVID-19 Horizon projects were prepared according to needs by European Union financial contribution. Can you see my presentation? Everything is okay?
Yes.
Hello?
Yes, yes, that's
okay.
fine.
Yes.
Because I have some. Okay, one moment. I'll try to. Is it possible to hide? Okay. As you can see, when we think about different categories, we can see here clinical management and treatment. So 45 projects, then vaccines, 4 projects, preparedness and crisis management, 25 projects, health system resilience, 27 projects, basic science, including biology of SARS-CoV-19 virus, 24 projects, diagnosis and public health measures. So in total, we have like 161 projects. And then there was also a specific action undertaken by the European Union to reorient the other projects to fight the COVID-19 emergency according to major needs. And here we have more than 800 projects also prepared for different categories. What's very important, up till September 2020, the European Union has already invested 458 million euro in 103 Horizon 2020 research projects. Especially these projects are targeting the COVID-19 pandemic. And these projects are focused on the development of diagnostics, treatments, vaccines, epidemiology, preparedness and response to outbreaks, socio-economics, production and digital technologies, as well as the infrastructures and data resources that enable this research. So as you can see, we have a lot of different purposes of the innovation cooperation. And now I would like to share with you some examples. As you can see, okay, one moment. Okay, so the one group of projects are preparedness and response. So as you can see, we have IMUV COVID-19, so multidisciplinary European network for research, prevention, and control of COVID-19 pandemic. And what's very interesting, also the number of partners involved in the cooperation. So as you can see here, we have 25 partners, also including partners from Central and Eastern Europe, so from Albania, Lithuania, and Romania. And the main aim of this project is to obtain epidemiological, clinical, and virological information on coronavirus and infected patients through the IMUV surveillance network spanning 11 countries. And the funding body is Horizon. Then we have HEROES, Health Emergency Response in Interconnected Systems, with 11 partners, also with the partners from Central Eastern Europe. Then we also have, one moment. Okay, then we also have Escalate Coronavirus, a smart platform against pathogens for the coronavirus, with project coordinator from Italy, with 18 partners, also including representatives from Poland, also in Horizon 2020 project. And here we have, as an aim, exploit powerful computing resources to identify molecules capable for targeting coronavirus and develop an effective tool to counter future pandemics. Then we have projects devoted to diagnostics, so COVID-Red and Dragon. So the projects that would like to offer us remote early detection, and this detection is also possible in a very short period of time, using different wearables or mobile apps. And of course, these kind of devices are very important in the diagnosis of patient and will help us also to offer a better treatment. Then we have also rapid COVID, so robust automation and point of care identification of COVID. Another example of a project devoted to diagnostic. So they want to develop a diagnostic test that can simultaneously detect SARS-CoV-2 as well as 30 other common respiratory bacteria and viruses, with leading coordinator from United Kingdom. And here we have the funding body Emmy. So this is Innovation Medicine Initiative. So the partnership of the European Union with pharma companies from FPA, so European Pharmaceutical Association of companies. Then we have for the treatment care, Corona Accelerated R&D in Europe, one of the biggest projects with 36 partners, also including Poland. Funding body IMI, also the goal is to deliver treatment for current COVID-19 outbreaks. Mainly, the aim is also to reproduce drugs, so we can also use already existing drugs to tackle the coronavirus. So this is very nice projects, also showing us how we can use already existing drugs to fight against coronavirus. And two projects regarding the vaccines, so Open Corona and Prevent Gov. Starting with the first one with the project coordinator from Sweden. They want to develop a vaccine that can also be used as a therapy against the coronavirus using a DNA vaccine platform, with 7 partners from Germany. And also the second one with University of Copenhagen. They want to develop and evaluate a potential vaccine that uses virus like cortisols to expose coronavirus proteins to the immune system. So what are the first promising results of Horizon 2020 projects? Of course, we should be aware of the fact that these are long-lasting projects, and for some of them, we will need to wait like 2 years to receive the results. But some of them, they have already first promising results. As you can see, for the diagnosis, we have HG and COVID-19 test projects. So this project offers us to diagnose and verify the virus just in 20 minutes. Then we have also Real Nano, where they try to use printable biosensors to detect the coronavirus. Then from the perspective of vaccine, we have 3 projects. One, which I just mentioned before, Prevent Cough. So they want to develop the vaccine, and they have already some initial results testing on humans in 2020. Then we have Osirix project, a French SME is behind the Osirix project funded under the European Innovation Council. And they also try to develop a universal vaccine against all existing and emerging coronavirus infections. So this, of course, will be very useful from the perspective of different mutations. As you know now, quite important are mutations from Great Britain and from South Africa, but we can also observe different mutations of coronavirus in different parts of the world. So these kind of vaccines, which will cover also different variants of coronavirus, will be really in the need in the next few months. And CuraVac, another example of already quite well developed project for vaccine. They try to develop the project soon, and probably they will be also available on the market in 2021. So when we try to verify, one moment. Another promising results from other projects in different categories. Here we have a very nice project title, Go Green Roots. So the project will evaluate the impact of reduced air pollution during the lockdown and its aftermath, as well as the impact on the mental health of urban citizens and their views on regreening their cities. And the second one, from the category of basic science, European Open Science Cloud, very important project from the perspective of different scholars, universities. So as you can see, the COVID-19 data platform run under the European Open Science Cloud is a free-to-use open digital space for researchers to share and upload data sets. And we have here a lot of different information which help us to provide and support not only from the perspective of our academic career, but also from the perspective of laboratory tests. So a lot of useful information about results from different experiments. So we can also use it as an open source for our academic and professional activity. So starting from the perspective of the last year, discussing, taking into account that the last year, we can say that European Union has invested more or less like €1 billion into research and innovative to face COVID-19 and its consequences. And of course, it would be not possible without the support of industry, healthcare, research organizations, non-profit organizations, and global partners, which rapidly prepared a coordinated research response to this public health crisis. What's more, the European Union is planning also to open a new research and innovation program, Horizon Europe, in 2021, with even more coronavirus-related research. So we will have probably new calls for different new projects. Of course, the situation is quite dynamic. As I mentioned before, we have vaccines already on the market, but having vaccines is not enough. Yeah, we need to think how to vaccinate millions of people in different parts of the world, and how to do it as fast as possible in order to have a better results. The last part of our presentation, of my presentation, is the role of open innovation in COVID-19 pandemic. And here I would like to share with you the results of several meetings, discussions with Professor Henry Chesbrough. I've had the opportunity to be a member of very nice webinar in November, so open innovation in COVID-19 pandemic, but also the conference of World Open Innovation Conference in December. Professor Henry Chesbrough is the father of open innovation. In fact, here you can see his two definitions, one from 2003 and one modified from 2014. Professor Chesbrough defines open innovation as a paradigm which states that companies can and should use external and internal ideas as well as internal and external paths to market. And what's more, they should use different partners in different projects. And from the perspective of the definition modified in 2014, it's a distributed innovation process based on a purposefully managed knowledge flows across organization boundaries, using monetary and non-monetary mechanisms in line with each organization's business model. So as you can see, they developed it also to different business models, and also this kind of cooperation could be quite well visible in biopharmaceutical industry. So we have a lot of different projects even before pandemic, but here we have a lot of activity also during pandemic, and probably will have more projects also after. Why the companies try to do it? Because by different modern model of partnerships like open innovation alliances, the companies have a high level of innovation capital, and they have better innovation performance, and that's why they have also better results in the cooperation. They can easily respond to different market situations, and they can also use a lot of innovation, not only in the company, but also outside the company to develop different projects. So as you can see here, we have a very nice comparison of so-called traditional and open innovation alliances. This is from the ASAP, Association of Strategic Alliance Professionals. And as you can see, when we think about open innovation alliances, we have open innovation model. We have focus on ideas, knowledge, and expertise. And we have open idea-driven partnership formation. Yeah, of course, we should look for some assets, yeah, but it's not really the most important thing in our cooperation. Yeah, the cooperation is idea. The cooperation is focused on innovation, on multiply parties, and we have a lot of different partners involved in the cooperation. Yeah, starting from the same industry, but also we can use cross-industry partnerships. You can develop different alliances with also multinational, international as well. Yeah, so here we have a lot of opportunities also to develop a lot of useful and important products, especially from the perspective of patients. When we think about the complexity of different alliance models here, as you can see, open innovations alliances are one of the most complex alliances. Yes, so they offer a very high degree of innovativeness, but also high level of complexity. Yeah, so they require a lot of important alliance management tools and skills to maintain, to develop these kind of alliances in a proper way. And as they are focused mainly also on the drug discovery, on the patient care, they are very important from the perspective also of the COVID-19 pandemic. And when you think about open innovation alliances, they were mainly implemented by different platforms, innovative ecosystems, crowdsourcing innovations for users, or joint development alliances. The one of the most important characteristics is also that they are also quite well realized with non-profit organizations, especially universities. So this business academia cooperation could be also be visible quite well in these alliances. And as you can see from the perspective of biopharma market, the main aim of these alliances is to understand the mechanism of disease and to discover a new utility of existing drugs that beyond their current curative role will allow identification and development of new drugs. Yeah, so we try to find some compounds which are not used in the company, but we can offer them repurpose, and then on basis of that we can offer some new drugs. So these kind of alliances, they are called drug development alliances, and we have a lot of examples of these alliances in United States, in the United Kingdom. So a lot of very nice cooperation. Also one of the former mentioned manufacturer of vaccines, so AstraZeneca, they have a very nice cooperation also of drug development with representatives of different institutions in United Kingdom. So when we think about visualization of open innovations in biopharma industry, we can see that we have a lot of different partners involved. So drug discovery, drug development, we have different phases. We can use external innovation projects to support our ideas. And if we have some additional results of cooperation, we can use it and offer it to different markets. So what is the role of open innovation in COVID-19 pandemic? This, of course, is very important from the perspective of COVID-19 pandemic defeating. And as you can see, these are the results of the discussion with Professor Henry Chesbrough. So he, during his webinar, he mentioned 3 key steps to deal with COVID-19 using open innovation. So one is of course, stopping the disease. The second step is start the recovery. And the third one is to manage the reoccurrence. And when we think about stopping the disease, it's very important from the perspective of vaccine projects. As you can see, we had this opportunity to start, in fact, in the middle. So we didn't need to start with the vaccine projects from the beginning. Why? Because we had some kind of knowledge, we had some kind of experience, and by open innovation, we have this opportunity to repurpose already existing vaccines and drugs to prepare new vaccines. So repurposing ideas for new possibilities. And as you can see, most of 50 vaccines candidates nowadays are existing drugs, so they are just being repurposed to different achievements. Then from the perspective of recovery, starting the recovery, the most important thing is to also think about how we can use open innovation to recover from the coronavirus. Of course, here open innovation also enable us to find some new markets, new possibilities. We can offer and verify different options on the market. So from the metaphor of Professor Henry Chesbrough, during the same amount of capital, we can create more shots on goal, so we have more market opportunities. And this kind of open cooperation with different partners also allows us to verify and see potential initial weak signals, which can also help us to prepare prepare earlier for some new pandemics or some new version of coronavirus. And the last one is to manage so-called the reoccurrence, so to prepare for the next potential pandemic, or for the next potential lockdown, or for the next potential crisis. And here, of course, we need to use open innovation from the perspective of digitalization. Yeah. So as you can see now, we are using Zoom. We have distant meetings, yeah, distant learning as well. But probably we will have this kind of meetings also for the next 2 or 3 months. We will see what would be the situation if we have some level of people vaccinated, but for now it's not possible to do it fast, because there are a lot of problems with the deliveries of vaccines from manufacturers. Then of course we have an opportunity to look for some new normal. So for some options, also using external partners, using different partners in our innovative ecosystem. We can also share some information and prepare for better. And we have an opportunity also to explore the situation on different markets. Of course, from the perspective of companies, we need to invest in reskilling our workers. We need to prepare a healthy and good infrastructure, so they can develop their skills. They can be still effective even if they need to work as a remote workers. And of course, we can use open innovation here as well to increase our innovative potential. So here we can also have an opportunity to identify the problems, but also identify opportunities on the market. And of course, by open innovation, we can also develop vaccine projects faster. So this is also very important from the perspective of patients. where here some of the companies are willing also to share the IP, so share the information about the production process. So probably we'll have also the opportunity to have some vaccines faster on the market. Then I would like to share with you a very short examples of successful innovation cooperation in COVID-19 pandemic. Yes.
Lucas, sorry, I think I don't know if you can just finish because
okay. I just like 2 slides more, so if it's not a problem. I cannot see my time when I share the screen, so that's why this is quite problematic. Sorry. So so just 2 minutes and I will finish. So from the perspective of the local potential, we have a very nice 2 projects. One, Wsparcie dla Szpitala, so support for hospitals, where different entities try to develop cooperation to support hospitals and social welfare homes. And the second from Poznań, ECMO for Greater Poland. So here we have an opportunity to use extracorporeal membrane oxygenation to support a patient with a very critical ill situation. And by ECMO, we have offered an opportunity to offer them the faster recovery. So from the perspective of final conclusions, by joining forces, different research projects like Emmy Horizon 2020, COVID vaccine projects, we can really contribute to defeat the COVID-19 pandemic faster. Of course, we need to be open for cooperation. We need to be open for innovation cooperation with different partners from different levels, as you can see from public, private, local, regional, national, cross-industry, and multinational alliances. And when we think about IT technologies, we have a lot of importance here. We have a lot of different new partnerships between pharma and biotech. So using IT technologies will help us also to better monitor, diagnose different patients. So as you can see from the CHESBRO site statement, good ideas can come from anywhere. Making openness is an imperative in this time of crisis. Global public health simply works better and faster when we open up. So by joining and by developing our pandemic-induced behavior, we can really contribute to building of the common good and improvement of the global public health. So we can see a lot of potential in these projects. Of course, as I told you, the main limitation of this presentation is that these are still ongoing projects. We do not have a lot of results now, but I do hope we will have the results, some of the results in 2021, so we can share also with you maybe later. Okay, so thank you very much for your attention. Sorry for not meeting the time limit because I didn't see my clock, so sorry for that. Thank you very much.
Thank you, Professor Puślecki. You have given us a very impressive talk about one of the most important things that we are living today, and how the 3 big companies are having the vaccines. Of course, there are others like Johnson & Johnson, as you have named, and also Gamaleya, Nava, and the ones from China, the Sinovac. They have 3 vaccines. But one of the things that I will that I think is very, very important is the investment that European Union have made in develop all these vaccines. And as you said, 1 billion euros. So this is great because this can give you to vaccine all the people in the European Union, but also in how this has been developing. And I was very impressed about the map that you show us, that there are at least part of Africa wouldn't have vaccines maybe until 1 more year, and maybe until that 2023, everybody will be vaccinated around the world. So I think this is very important. I have a lot of comments. I take a lot of notes. And I know that then we can see again because we are recording this event. But one of the things that also is very that I admire, the Professor CHESBRO, the Open Innovation Alliance, that brings us a lot of promises of a better life. And you finish with stop the disease, start recovery, and manage the recurrence. Because of course, if we don't make some international policies to change the way how we are living, the way how we are consuming, we will continue having more virus and more aggressive to our lives. So thank you very much. I have some questions, but we are going to pass for the conference that Professor, a PhD Professor Carlos Bustamante will give us in minutes. He's a senior research in the Economic Research Institute at UNAM. He is economist of the same school where I study, the Facultad de Economía, the Faculty of Economics of the UNAM. He has a diploma in regional and town planning in Poland, in La Politechnika Sińska Polska in 1971. And he also has a master in economic planning of urban development in the University College of London in 1982. He's teacher and supervisor in the Faculty of Economics. He works a lot in this program, especially in the he has a lot of students that work urban issues, and he found
Your image was paralyzed.
I think we lost contact with Girón, right, Carlos?
Yes, and I can hear what Alicia said, and her image and sound was lost.
Maybe if someone could send her a WhatsApp message.
Yeah, and in the meantime, if I may interrupt, maybe we will continue with your presentation, Carlos, and we hopefully may say that Alicia. Oh no, she's back.
I am here.
Okay, so
I am changing the place. Well, I will finish the presentation of Carlos. Sorry about this. I was saying that he found a seminar, a very important seminar in Mexico, which is the Economic, Regional, and Urban Development at the Economic Research Institute. It was founded in 1986. He was president of this association, a MESIDER, who is affiliated to the Regional Science Association International. And he has more than 20 books and 30 specialized articles published as author and co-author. Well, Carlos, I will give you the microphone. Thank you very much.
Thank you very much, Alicia. Well, first of all, everyone, I'd like to thank particularly those to extend the invitation to me, particularly the Embassy of the Republic of Poland in Mexico, the directors of the Institute of Business and Economic Administration of Poznan, and our director Armando Sanchez, director of our Economic Research Institute, as well as Dr. Ida Musiałkowska and Professor Eva Miska. Everyone, thank you for your invitation. So I'd like to start with my presentation. I hope it would be, yeah. Well, you may say here the main title of my presentation, that is the Regional Socio-Economic Outlook of Mexico during the pandemic lockdown. This paper intended to provide, particularly to scholars from abroad, a general outlook of Mexico's economy and regional social and economic inequalities throughout this country. Once being understood that, it is expected to understand why is it that the high numbers of contagious cases cannot still be lowered. And Mexico is today one of the nations among the worst numbers of COVID-19 contagious and deaths in the world. The COVID-19 pandemic has hit social and economic activities worldwide. However, the impacts caused in the less developed countries have probably been harder than in the developed nations. This paper proposes that backward states, institutions like Mexico, governing a territory and people with many shortages in infrastructure of several types, and with enormous gaps between rich and poor people, then have faced the pandemic and measures adopted with many problems in their implementation. I present to you this main table of contents. I start with a brief outlook of the Mexican economy at national and regional levels. Then passing to some general and regional aspects of the economy and the population distribution on this country. So, the Mexican economy has to be seen from their historical relations with the USA's and from their public policies throughout. This might be studied from multiple dimensions and multi-sectoral too. All these factors can be understandable because the long borderline of more than 2,000 kilometers between two countries. Our historical relationships have been made of hard disputes among the two countries. Some very harsh examples are the USA's invaded Mexico in 1846-47, and Mexico lost more than half of our territory. Further, military interventions into the Mexican territory during the Mexican Revolution. Here we may see the map of the amount of territory in the north part of Mexico who was lost by the war. So this, since then, the American institutional and organizations, public and private, are frequently pressure Mexico to favor their interests operating in our territory, in mining, railroads, oil extraction, and so on. Not even mentioning losing part of our southeastern territory, nowadays Belize, by the end of the Mayan indigenous rebellion in the Yucatan Peninsula that finished in 1901. Social and demographic relationships in terms of exchanging of goods and services, labor, general migration, and even culture from both sides. Yet, the penetration of the USA economic power has brought some benefits as well in terms of the general concept of growth and progress. For example, during the two greatest world wars, Mexico registered the higher industrialization and urbanization in all Mexican centers. What is the performance of the Mexico's economy? After the financial debt crisis in 1982, was the signature of the Structural Adjustment Program. With this, and then with the signature of the North American Free Trade Agreement in 1994, was the beginning of the policies of liberalization of capital, goods, and services. But it's important just to underline the main conditions imposed to Mexico by the signature of the structural adjustments that were financial repayment to the public debt, considerable reduction of the state power in the definition of the national economy, process of privatization, decentralization, inflation controls, opening market to foreign capital, and freezing salaries to working people. There were some results, very important. Strengthening on foreign capital and their location mainly in the northern part of our country, and weakening of the government intervention in most of the economy. This, you may see the main map of roads from the center of Mexico to North America, and one very light pink line from southern Mexico that is coming from the oil exploitation centers during the liberalization of the economy. Through all these roads, main centers, productive centers have growing very fast. What is the main structure of the exporting sectors? Mainly oil products and mining products, who represent 57% of all exports. The manufacturing products, 38%, and agricultural products, only 5%. From this, Mexico has received considerable amounts of federal direct investments. In the last 10 years, Mexico received US $589 billion, from which 47% came from the USA, 31% from the European Union, included England now, that is not the belong to the European Union, 7% from Canada, and 5% from Japan, among the most important origins. By the way, last week was announced that the federal direct investment during the 2020 fell by 11.7% compared to the previous year. From these federal direct investments, we obtain shares from the transport equipment, 34.5%, computing, communication means, and electronic accessories, oil and gas extraction, electric devices and power generation devices, machinery and equipment, and chemical industry. These 6 subsectors represented 82.2% of total exports during such a period. Only 14 subnational states represented 57.6% of the total exports, and most of them are located on the north of Mexico. Well, it's very difficult to see this graphic in which are the expansion of the productive sectors in Mexico during the last 20 years. Some recent impacts on the Mexican trade. Mexican exports fell in 2020. The trade statement of Mexico registered a positive balance for about 476 billion American dollars. The general fall of the international commerce affected many factories and industrial plants' demands from the USA and Canada. This results in a high reduction of imports that were 15.8% less than the previous year, and a bit higher reduction in exports by 9.3%, that is less than the figure of the previous year. Among the higher contraction in exports were the automobile industry and inbound factories established mainly across the northern border with the USA. Crude oil sales and manufacturing intermediate products to Canadian and American factories. Among the higher contraction in exports were in the automobile industry and inbound factories established mainly across the northern border, crude oil sales and manufacturing intermediate products to Canadian and American factories. And likely the only two sectors less affected because registered positive increases were agricultural products, whose sales for $18.7 billion, which means 4.7% more than the previous year. And the other subsector was mining, except oil, whose sales were $7.4 billion higher than the previous year. Some aspects of the liberalization of the Mexican economy. The economic growth has been very uneven and low, with the regional and social polarization into our territory. Subnational states and local municipalities growing faster in the northern and western parts because they are mostly integrated to the NAFTA, where extremely low growth and marginalization in the southeastern part of our nation. Sorry. Two exceptions within this region are Campeche and Tabasco, southern states, which are specialized in oil exploitation. We see the map in the next page. The inbound manufacturing under the transnational enterprises control has been the predominant weight of the industrial production rather than the domestic industry, which is mostly inward oriented. The location of them has impacted the regional growth of the population in the industrial centers of the northern and central subnational states by the internal migration. We may see here the gross domestic product by subnational states in Mexico, and we observe that the market colors are in the north and lowering in the central north, and just exceptionally the capital city and its metropolitan area that is here, and the southeastern states, which are where is the oil exploitation. And also in the Caribbean Sea, where the tourist industry or tourist services are in the heydays. Here in this map, you may see the population density in the municipalities of Mexico that are mostly accord with the growing of the productive activity, and in some points in the metropolitan centers of the north and border cities with the USA. The economically active population in last year was distributed, as you may see here in this map. Of course, the largest concentration is in Mexico City and the peripheral metropolitan area. And then to the west, central western part in Jalisco state, and a little less in the northern states because of their extension. They appear to be with lower percentages. I present here some negative and social and territorial impacts from the liberalization of the Mexican economy. There is no transfer of IT knowledge from the foreign enterprises operating in Mexico to the Mexican laborers. The pressing low salaries among the working people since the adoption of the Structural Adjustment Program, plus the North American Free Trade Agreement, This too has created a big gap among people's gross domestic product per capita and poverty among more than 60% of the total population. Because the argument of limited income revenues of the government, most of the subnational states and municipalities have abandoned the public expenditures to provide basic infrastructure and services to urban and rural centers everywhere. Therefore, Mexico registers one of the lowest salaries in all Latin American countries. For example, US gross domestic product per capita is nearly 5 times higher than Mexico's gross domestic product. Here we may see some lately general figures on population and poverty. The recently published population census for Mexico last year registered a total of 126 million people. Approximately 80% of people are living in urban areas, whereas only 20% are settled in rural areas. Mexico City by itself hosts 9 million people that represent 7% of whole nation, whereas its neighbor and peripheral state of Mexico hosted 17 million people. They together concentrate 20% of the total of Mexico. You may imagine how is the concentration in the whole country. There are big gaps between gross domestic product per capita by states, higher salary levels in the northern states, and the gross domestic product per capita in the southern states that are nearly 1/3 of the northern states and Mexico cities. In the last 4 months, labor incomes gap between the richest and the poorest has nearly doubled from 29.4 to 50.1%. Today, it's estimated that 52.4 million inhabitants live in poverty. That is equal to nearly 42% of the total population. You may see here the map of the poverty distributed by municipalities in the whole country. So you may see the states in the northern part are mainly because of the concentration in the capital states of the northern states and some other rural neglected areas, but mostly are in the peripheral Mexico City and southeastern part of the country. While looking at the map of poverty by municipalities, there is no need to mention all their subnational states' names, but it's worth saying that most of them are located in the southern states of the country and the central part, and some others are concentrated in the metropolitan zone of Mexico City. And this is why we may assert that people's agglomeration and poverty could be 2 of the main 2 factors causing contagious by COVID-19. This is the map of yesterday, registered by Coneval, that is the National Commission for Evaluation of the Social Policy in Mexico. And this another map is one iterative map made by Johns Hopkins University, who register the global debts and also the Mexico debts that yesterday were more than 180,000 people debts. From the positive cases were located in the larger metropolitan areas of the country, which are marked here. And this is another map of yesterday from the Johns Hopkins. Well, you may see here the number of infected cases by the principal states. First is the Mexico City, then the state of Mexico, then Guanajuato state, and Nuevo León state in northeastern part of Mexico. Jalisco and Guanajuato are in the central western part of the country. So what are the main public actions upon the COVID-19 pandemic? All the health institutions working all over our country, that there are 5 of the most important, operated their protocol for assisting the infected cases as they usually have successfully done it for any pandemic disease in the past. There are very close relationships with the Health World Organization in order to implement the health protocols upon any pandemic worldwide. Yet, from the economic point of view, the government has delayed in realizing the critical situation of many economic units and their workers from all sectors due to the lockdown and closing of their productive activities. The most hardly affected sectors were automobile industry, building, metal and metallic industries, tourism, and the like. That was one of the reasons why in the last month of June, Mexico was pressured from the USA's economists to open and to reactivate the automobile industry and other inbound factories in the border of Mexico. The central government of Mexico began an assistance program to micro and small size enterprises, though the amount available was a bit late and not sufficient for helping them to cope with the lockdown. At the same time, it's important just to cross with what are at the present the main national government's policies. First of all is the called austeridad republicana. That means a hard contraction of public expenditures by the application of substantial savings in the government's administration expenses and reorientation to strategic infrastructure projects and social programs. Refusal to further indebtedness from abroad, whereas reinforcing fiscal actions without rising taxation. Investing in some infrastructure mega projects. Among them, I try to stress a Transsismic railroad and the Mayan railroad called the Tren-Maya across the Yucatan Peninsula. These are very important projects because they try to integrate the southeastern part of Mexico, which was mostly neglected from the central government policies during more than 50 years. There appear very slightly some projects for the southern part, but they were stopped or frustrated because the changing of the administration every 6 years. Another integral program, mega project is the integral welfare program through integration of rural microcenters. This is very important because through this program, the social services servants are penetrating into the most neglected rural centers in the country. So through this integration of rural microcenters, it's expected that many of the social policies are reaching even the farther neglected rural areas in the country. Why is important these 2 mega projects that I mentioned? The Transsismic Project It's a very old project who was frustrated in the past, but now is just practically started and is crossing the narrowest part of the country from the Gulf of Mexico in Coatzacoalcos to the Pacific Ocean in Salina Cruz. We may see here that this project consists on the construction of a main railroad system that was incomplete in the past, and plus 2-lane highway, 4-lane freeway, and the modernization of 2 airports in both sides of this territory. The other one is the Tren Maya, the Mayan Railroad project. As you may see here in the map, this railroad is trying to interconnect most of the Yucatan Peninsula, which is very attractive in tourist archaeological zones, which are visited, only some of them in the Caribbean shores, in Cancun, Playa del Carmen, and other points. But now it's intended to interconnect all the peninsula. Here in the northwestern part of the peninsula is where all agro products and agro industries are developed. And historically, they were expanded through the Caribbean and southeastern part of the USA. But now with this, it's intended to interconnect just the Central American countries here through Belize, Guatemala, and the southern. And from this new railroad is the connection to the rest of the country, transporting goods, services, and it's expected that all these projects will develop several small centers and interconnect the peninsula with the rest of the country to the development growth. Well, it's expected that the COVID-19 will prevail during 2021 year, but according to the expectations and the priorities given to the more to the poorest people, the poorest regions, and to the most neglected areas, and also to the people over 60 years old, and trying to decrease the priorities, to extend the priorities to younger people throughout the country. I don't want to extend more my presentation, but I will be very pleased if there are some comments or questions about it. Thank you very much for your attention.
Carlos, thank you very much for this incredible talk that we have seen, especially your maps, because for people who are not, that don't live in Mexico, the thing that you can see is the integration that has the Mexican economy with the USA, one of the biggest economy in the world. But this integration, it has been signed by the NAFTA agreement, and the NAFTA agreement has closed the, I'm so sorry. Otra vez. I think I am having again some problems with internet. I am moving. Are you hearing me? Yes, I'm seeing you.
Yeah,
well, yes, we can hear you. We can hear you.
Yes,
yes, no problem.
One of the things that I want to point in the conference of Professor Bustamante is these great maps that he has shown us, especially because we have to understand the integration between Mexico and USA. And this was very important because most of our products, what we export and what import, it is very related with one of the biggest economy of the world. And also one of the things that we have to see is how this NAFTA agreement has put us in a very how can I explain, in a very austerity policies, especially because in the agreement, in the 14th chapter of NAFTA, we have to depend our monetary policy from the Federal Reserve of USA. So when you put your monetary policy and your fiscal policy and your financial policy in the hands of this agreement, so that's why we have had a lot of problems and a very big change in our economic structure. So also one of the things that he has pointed, and is all the projects that the new government has pointed to have development in the south part of Mexico, which is the Maya Railroad, and also that Transsismic, who was, as Professor Bustamante has told us, it was an old project. So we hope that this project will finish before this administration finish, that it will finish in 4 years. So we hope these projects will have a better development for all these zones. Another things that he has pointed is how the lack of infrastructure that we have had. And when you see that the integration that the Professor Bustamante has made with the Johns Hopkins University, this map that Johns Hopkins has of how many deaths that we have from the COVID-19 is related with the lack of infrastructure and especially with the lack of water. So this puts in a big problem, and I don't know how we can resolve, because one of the things to stop COVID is especially water and a better health system. So there are some questions. I don't know, here I'm going to begin with one, and it is from Isalia, and it says, in regard to innovation, which lessons have been learned that can be carried into post-COVID-19 life in order to enhance community well-being? So, well, I don't know, Isalia, is this for Łukasz or for Carlos, or I will give the floor to both if one would like to answer. I don't know, Łukasz, if you want to say something.
Okay, so thank you very much, Alicia, for this question. So for sure, one of the biggest lesson, I think, is all lesson devoted to the diagnosis of patient. So because of the COVID-19 pandemic, most of us now are benefiting from different new digital health solutions. So we are quite well acquainted with telemedicine. So probably this model of first fast diagnosis will be also in the post-pandemic world. We will see how it will be developed, but on the basis of different research articles and different information from different scientific and business magazines, we can see that there is a growing number of different biopharma IT alliances. There are a lot of new digital healthcare startups. Yeah, so probably after COVID-19, we will see a lot of useful new devices, also with the use of Internet of Things, with the use of big data analysis, which will help us to better offer the better treatment to the patient. Yes, so I think this is one of the biggest lesson. And the second lesson, I think, is also regarding the prevention, regarding our private prevention equipment. So as you can see now, when we have all these hand sanitizers, when we wash our hands quite common, then we do not see some disease that we had in the past. So probably this is also another lesson that when we take care about our health, probably we'll have better results also regarding our health in the future. Of course, one of the biggest challenge, as I told you, is mass vaccination. without vaccinating people around the world, it will be not possible to defeat the COVID-19 pandemic soon. So this is the real problem. And unfortunately, I put this sad map that 85 countries will have an opportunity to have a vaccine in 2023. So this is a long process for these countries. So we are happy that we have this opportunity, but we should take care also of these countries as well. Thank you.
Thank you, Łukasz. And well, Carlos, I have a question for you. How to rethink general aspects of the economy in a context of socio-economic inequalities? How we can do it, Carlos, please, I give out the floor.
Okay, thank you very much, Alicia, for your comments and your question. I try to respond in some way. One issue not very well studied is from the sociological and urbanistic analysis. It is the poor social conditions of marginality, overcrowding of people in social council houses, and scarcity of public services, such as local and metropolitan transport systems and workplaces. All this compel the peri-urban people to commute every day and to be exposed to crowded interactions to others and diverse types of viruses contagious. Therefore, urban planners should provide basic elements of infrastructure and equipment to new human settlements at the time in which such settlements began their construction. All this scarcity of services and equipment has been left by the liberalization, in which the central and local governments use this as an argument for saying that there are limited resources to invest in urban equipment. So for the health institutions, it should be worth look at the peri-urban and poor areas around the metropolitan centers, because their population are most likely to commute into their employment sources, marketplaces, and education institutions, which are mostly located in the original and distant centers. So this agglomeration and overcrowding in their own houses are more exposed to the contagios of any virus. So the main policy would be directed towards trying to insert some equipment to all these areas, and also is a reeducation of the population, because we have seen that there have been many resistance from the people living in all peripheral areas and neglected ones in rural areas, that they are very, how you say, resistant to the policies and programs published by the media. So they are against that, so they are resistant to take any recommendation from the health institutions, just to try to keep all the ordinance for avoiding the infections. So that is one of the lessons that are that there must be taken in the future. So in the economic point of view, I think for the next few months, we may suffer from the same recession. And as we are very close linked with the North American economy, so we are expecting that as the pace in which the North American economy in the USA and Canada that demand more goods and services and input products. As this pace, it would be the rhythm of the Mexican economy recovery. Apart from the policies that try to reinforce the manufacturing industry that is inward oriented, if the government will reinforce and make more public investments to make these manufacturing industries inward oriented to be reinforced, it would be expected that the economic growth will recover probably up to the end of 2022, in the next 2 years. Well, I may say this. So, well, the regional development theories and practice has developed more rapidly in the industrialized countries than those in the developing world. That is true. Terrible experiences in their own territories, particularly in Europe, have obliged them to act faster as well in terms of the destruction of the whole towns, industrial sectors, housing, as well as their ancient and rich architecture. In the case of the Mexican experiences, trying to plan human settlement systems has resulted most of the times in the private occupation of land and displacement of whole rural communities as a justification of modernization. Accordingly, it is needed a more effective regional development planning by looking first at the local and regional potentialities to grow from a government perspective of getting benefits to all, and towards a truly socio-economic integration to the nation's interest as a whole. That is my perspective. Thank you very much. Probably there is our confidence that we may cope with the recession and come back in about 3 years to the social and economic processes of growth with welfare to the whole nation. Thank you, Alicia.
Thank you. Thank you, Carlos. Yes, I would like to make just to end a little bit, 2 comments. First of all is that really Mexico needs a policy of full employment that we haven't implemented since many, many years ago. And sometimes austerity programs are not the best to create employment. And as soon as we create more employment, we are going to have a better development and also a better income distribution. That's what's needed. And right now, what we need is a monetary and fiscal policy reform immediately, especially the fiscal policy. But as we have seen, especially what Carlos was telling us, the access of water is the lack of infrastructure, and it is the lack of the public budget. And the public budget has been decreased a lot, especially in health and in education. And most of our budget goes to pay the external debt, which is amazing. So we hope we will have very soon a fiscal policy reform. And also what Carlos has told us about if the improvement of USA will continue with Biden and will have a green policy. Also, they have to change a lot if they want to compete with China. And besides that, I would like to ask just a last question to Łukasz. Łukasz, what do you think about the health shock policy? Because when you see how China is giving the vaccines to Africa, I just forget the one country. I think it's Ethiopia. I don't know what's it in the red.
Morocco.
It is in the not Morocco. It is in the red part, in the red Gulf,
Somalia.
Africa, something like that.
Somalia.
No, Ethiopia, because they are in Pakistan. They are trying to find where to put their vaccines, and this is amazing. Even in Peru, they have already sent the Chinese vaccines. So, of course, this is very interesting. But of course, one of the other things, Łukasz, that maybe for the next conference you have to explain us how how has increased the stakeholders that have the control of AstraZeneca, of Pfizer, and Moderna. I think that this new concentration and centralization in these big pharmacies and with the biotech companies is a very good. It will be, well, I would like to, that the next conference of this series that we are having with your institute, with your faculty, will be very interesting for us. Well, I have to finish the conference. I don't know if there is another, yes. Here I want to announce that the next conference, and I will invite all our fellows that are seeing us, and also the ones that are in Facebook, in YouTube, in all these social nets, to come and visit us the 13th of April at 11:30 a.m. in Mexico City, and 6:30 in the afternoon in Poland. And to these sustainable lessons from COVID-19. And what we will see in the next conference are the effects of the COVID-19 pandemic in Latin America and Europe. So thank you very much, Lucas. Thank you very much, Carlos. And well, how to say, a big to Poland, to our fellows in the University of Poland, and also to the fellows that are here in the Economic Research Institute. And welcome to UNAM. And we hope one day we will see you here. And
thank you very much, Alicia.
Thank you very much.
Thank you very much. Thank you very much.
Thank you
to all of you, and see you later.
Thank
See you
you
next
very much.
month.
Bye.
Okay, bye-bye.
Bye-bye.
Bye. Thank you. Bye.
Do widzenia. Do widzenia.
Do widzenia. Adios.
Adios.
Hasta luego. Wow.